We know that the first vaccines have arrived in South Africa. We're expecting the President and the Health Minister, as well as healthcare workers, to get vaccinated shortly. Our reporter, Bulelani Philip, is standing by in Khayelitsha. Very good afternoon to you, Bulelani, and over to you.
Well, thank you so much, Zinga, and good afternoon to you again, to you and the viewers. Of course, a hive of activity here at the Khayelitsha District Hospital, where we expect the arrival of President Cyril Ramaphosa, as well as Health Minister Dr. Zweli Mkhize, to take their jabs right here at the Khayelitsha District Hospital. Of course, what we do know for now is that this hospital will be getting 50 doses that will be administered today. Provincially, it's expected that there will be about 13,000 vaccines that will be administered, both here at the Khayelitsha Hospital, at the Tygerberg Hospital, as well as the Groote Hospital. Of course, a lot of interested groups are here to get to know how this rollout plan of the vaccine is going to unfold. I'm going to bring into this conversation Dr. Anis Ismail, who is the head of the trauma units at the Melomed group of hospitals. Good afternoon to you, Doctor.
Good afternoon.
Firstly, as the private sector, how do you intend to roll out the plan? Are you going to be part and parcel of this rollout plan of the vaccines?
Absolutely. We are going to be part of the government rollout plan. I've come here today. I'm very honored and privileged to be here today to be one of the first recipients of the vaccine. I truly believe that the vaccine will herald the beginning of the end of the COVID-19 pandemic. But of course, we live in a world of lots of fake news and misinformation, and this has created lots of fear and anxiety around the vaccine. And having gone through the data myself, I'm very confident that the vaccine will save lives. And of course, as a healthcare worker, I felt it was very important to set that example for my family, my loved ones, my colleagues, my co-workers, as well as the public. And like I said, I'm very honored and privileged to be one of the first recipients.
For a person who's sitting at home, they'll be asking the question, I've got a medical aid. Can I jump the queue and get the rollout of the vaccine jab before anybody else?
So the way the government is rolling out the vaccine is in different phases. So phase one would be healthcare workers or frontline workers who have direct contact with patients suffering with COVID-19. And then phase two would be essential workers and other vulnerable populations. And this will happen throughout the quarters of the year. And during phase three and phase four of the vaccine rollout, your general population will have access to it. And the hope is, of course, to get the majority of the population vaccinated in order to achieve herd immunity.
Now, we know that today is going to be administering the Johnson & Johnson vaccine. In your medical experience, any view on which vaccine must be procured by South Africa? We just had an incident where we told the AstraZeneca vaccine is nearing expiry date. Your view?
So with the Johnson & Johnson vaccine, the trials were done across multiple countries, including South Africa. And the good news is that it was tested against the 501 variant of the virus, which was very prevalent in the second wave in South Africa. And it's proven to be safe in terms of preventing severe COVID-19, as well as preventing deaths. Logistically as well, it's a single-dose vaccine, which is obviously easier to administer rather than multiple-dose vaccines. And it's also able to be stored at stable temperatures. So it definitely makes sense within our context.
Lastly, before I let you go, there's a debate around the administration of the ivermectin. As a medical professional, what's your view on that? Do you think it can be effective?
Sorry, can you just...
The ivermectin, do you think it can be effective, given also it must still go through the approval of the regulator? Yes.
It's a good question. You know, as a doctor, I always adopt the approach of first do no harm. So when I've looked at the data myself for ivermectin, unfortunately, the data was not of a quality that convinced me. And I would never prescribe a medication to a patient that I'm not sure is safe or effective. So at this moment, a personal decision of mine, I wouldn't be prescribing it up until we have better quality data that proves that it is safe or effective.
Thank you very much, Dr. Anis Ismail. Of course, he is the head of trauma units for the Melomed group. Of course, giving us his rundown around the rollout plan in the private sector. Of course, the private sector will also be working with government in terms of this rollout plan of the Johnson & Johnson vaccine. For now, Nzinga, we'll cross back to you in studio.
Bulelani Philip giving us an update from Khayelitsha there. He's going to be there for the afternoon as people await the arrival of President Cyril Ramaphosa, Health Minister Dr. Zweli Mkhize, and the beginning of those inoculations against COVID-19. Those COVID-19 vaccines that have arrived late last night, 80,000 doses of them to start with, more expected in the coming weeks.